we'll pick it up from where we left last class, which was, starting the placenta. So in the previous class, so we did look a little bit into the maternal recognition of pregnancy and the early stages of the embryonic development. So all those pictures with the elongated, conceptus, the elongated embryo, and how it communicates with the endometrium, to block the luteolytic signal, which is basically meaning to block the synthesis or the action of prostaglandin. So in the slides, you do have quite a few examples from swine on the bovine. To me, the most important is that you understand that it's to block the action, of prostaglandin. If it is by blocking synthesis, if it is by blocking, diverting the secretion, whatever that is, to me, any of those explanations, if at some point I ask you this, that is fine. And then after that, so we went on to talk a little bit also about the immunology and a few concepts of the immunology and reproduction. So the idea that, this, after you go into this very first stages, and actually all the way from fertilization, there needs to be, and the uterus in that sense is a very special place from an immune standpoint, because at the same time that it has, as any other organ, has to defend itself if there's infections and on. So there is access of defense cells, to these organs. At the same time, the uterine environment needs to have strategies in which, kind of shield, the embryo against actually rejection. We mentioned a couple of things, 3 or 4 things. One is because of a little bit of the absence of MHC1 in some of the trophectoderm cells. The other one is progesterone, which tends to be highly, is in some ways vasoconstrictor, but also tends to dampen, a little bit the action of cells in that region. But it was the idea that also is was to mention a couple of things as reproduction and immunology tends to go hand in hand in a few things, including the molecules that are part of these two systems. Well, after that, then we went on to start these the maintenance, basically, of the gestation. And during the rest of the gestation, which will vary, of course, depending on the species, you still have to keep some of that, balance between the immune system and the embryo in check, but it's no longer the primary concern of the mother. At that point, the placentation, which basically is the actual physical connection. The placentation basically is the first time where you're going to have actual cells from the two tissues in real contact with each other, and at some point you're going to have exchange of nutrient and gases and everything else between the baby, between the fetus and the mother. Now, at this point I'm going to stop. I'm going to go into some pictures that, I forgot to mention this, like very, very nice site, about, images and whatnot from veterinary images for reproduction, basically. But the idea is, I think at some point in the previous classes, I asked you guys, when you think about a placenta, what do you see? And this is a question that normally arises because it is this rennet, is this kind of, if you think of a heart, you know what it is. If you think of a lung, you know how it is. If you think of a kidney, you know how it kind of shape look like. But if you think of a placenta, to begin with, is this temporary thing. It will only last through gestation. It's almost like the corpus luteum. It's like this weird gland. It kind of survives for a while and then it dies. Placenta is the same. It will start, but then eventually you'll basically, expel that. So the placenta, as definition goes, is really the site where the two tissues from the mother and the embryo connects. Okay, this connection will always occur between the endometrium because it is the most internal layer of the embryo and the extraembryonic membrane of the embryo. Okay, so it's an endometrium and also the extraembryonic membrane. Very commonly, very often, the two most external extraembryonic membranes in mammalians is either the allantoid or the chorion. Most of the time, the chorion. Okay, so that's why sometimes, the names that we give to some, especially when we classify those, that placenta from a microscopic point of view, it really depends on where the endometrium, the epithelium of the endometrium connects with the baby. Okay, and we're going to see that there are differences among species on how basically how much the invasion of these cells occur. It can be very kind of superficial epithelial with epithelium, but also can be almost like an epithelium with the blood from the other. So it varies a little bit, and we're going to see a little bit of that. Obviously, this is everything that it does. Exchange nutrients, exchange gases. We mentioned a little bit in the previous class that yes, the placenta eventually will produce hormones. It will produce quite a few, and in relatively good quantity. They will be important not only in some species, especially, and particularly for some species that might depend also on the placenta for the production of progesterone. It will be super important for maintenance of gestation, but it will also be important for the beginning of lactation later on. Okay, so you're going to have a little bit of both. Another thing is the placenta will also be responsible for basically mediating the shift that will happen close to parturition as far as some of the hormones go. So it will be important for that as well. The placenta, and I think we had this slide sometime early on. The uterus, for most of the domestic species that we see or that we are interested in, it tends to be, it's not the case of humans that doesn't have, like the humans do not have cornuated, what we call uterus. It is basically a body that is only at the body of the uterus. The other species that we deal with, you have these horns. Okay, so you divide it into the right and the left horn, and so you have the cervix, the body of the uterus, and the horn. The horn, if you remember well during the lab sessions, once you open the uterus, especially those that you saw like bovine, you see little dots, inside. And not all species have those little dots, but some of them are like micro, really small and very spread in some species. In that case of the cattle and cows, you're going to have some of those. The idea then is that those dots, for example, in cows will be these places where you're going to have actual attachment, with the extraembryonic membranes of the embryo. So imagine that, that little tapeworm there. So the next, we're going to go into the internal structures here, but I'm going to show you just this little slide. This is how it looks like if you take it, from, this is basically a cow's placenta. That's how it looks like. Let me show you one little picture that I got it from this. Actually, this is a very, very nice, actually, website that you can see lots and lots of good pictures. That's pictures of when I spent some time before coming to UBC. I spent some time in the vet school in Florida, and this guy used to, he collected thousands of pictures of everything he saw during his profession, and is actually a very nice collection and database of pictures from many species, and it has pictures all the way from calving to estrous cycle to abnormalities and so on. So it's pretty informative. So this is what the placenta actually looks like. And then you say, but everything somehow, yes. Why? This will be the sites. So this is basically the extraembryonic membrane. Inside of this bag here, the baby is, the fetus is. All of these dots here were at some point attached to the endometrium of the mother, okay? And through that attachment, you would have the exchanges of gases and everything else. So what happened here? So, well, during, parturition, you would have what? The baby will leave first, and this placenta eventually will have to peel off from the internal side of the uterus and come off as well. Okay, so the same happens in every species. You're going to have what? The baby coming off, and after that, shortly after that, in most species, the placenta comes off. Okay, so the idea then is that you would have, when people ask you or say, oh, the water broke, you have the first stages during parturition. What is the water? You understand the question when people say, oh, in movies, oh, the water came out. Okay, nice. What is the water? Amniotic fluid, some allantoic fluid, whatever liquid that is around here, but most of the time amniotic fluid. So why? Because all of that baby is within bubbles. First, the amniotic vesicles, the first bubble that protects, and then you have all this chorioallantoid that gives rise to all of this. And if you pass this and you move on and on, you're going to see, oh, there we go. This is how it looks like. The caruncles. Oh, that's gross. That's nice. So here you catch, and it looks really like this. This is a really nice, but this is in cattle. Okay. Now, the previous picture, I think we had it here, was from the dog, and I like to show the dog because it is really different. So you come to any species you want, and eventually you're gonna go, okay, the normal placenta here for the dog, and that's what it is for the dog. Okay, so you have the little dog here inside, nice. You still have that bubble, which is the extraembryonic membrane. But instead of being spots like it is in cattle, it is just like a strip around it. So they call it zonary placenta. For us, how important that is, I think for us is really the curiosity side of it that said, the placenta in different species will look quite different. Okay? In humans, we call something that the name of the type of placenta in humans is called discoid, because it forms like a little disc in the bottom, and that's where all the changes or all the exchanges actually of nutrients and gases occur. It doesn't really matter. To me, I think it's really important that you understand that different species, they have different formats, different shapes of the placenta. But I think the most important part in this case is that you understand that you have the extraembryonic membrane. Certain parts of this extraembryonic membrane will get in touch with the specific places in the endometrium. In these specific places, you're going to have penetration of cells from the embryo and also the mother, and you're going to have that exchange. So there is going to be a lot of cell differentiation in those spots where the connection occurs. Okay, so this is the quite important part. And by all means, this website is awesome. It had lots of very nice pictures there. Very good. So these prominences that you saw, for example, in the cattle, which is one example, and this visually is very good because you have like these little dots all spread. You call those caruncles. Okay. The actual counterpart for the fetal side we call cotyledon. So in those little bumps, in those little differentiated cells in the uterus, once he attaches, you have apposition and you have physical contact between those cells. Something happens in that region and the cells start to differentiate, and eventually you're going to have invasion of the cells from the embryo side towards that caruncle. Okay? And that will be the beginning of the formation of those big rounded spots. That big round spot, eventually, imagine you would have like the connection between the two, and imagine that, when parturition comes, you're going to have to basically, the baby is out, and that thing will have to really be physically removed from it. So in general, you're going to have, for example, humans, in general, you have quite a bit of bleeding. I'm going to explain why. In cattle, in cows, you don't have that much bleeding, but you have a little bit. And the bleeding comes from this detachment. Once you have the penetration of one cell into one tissue into the other, eventually you'll have to come out. And with this process, you're going to have some bleeding. Okay? Okay, so see, this is like obviously a drawing of pretty similar to the ones you saw in that website. Imagine you have the baby inside, but imagine this is out. Like you will never see the placenta like this, but this thing is going to be all inside the uterus. Okay. Remember when I said, and I asked you at some point, where is the umbilical cord, Ronaldo? Where's that thing in all of this? Either the zonary, the discoid, or the cotyledonary. So you see here, this is the external side. You will see that, there are vessels connecting all of them. And eventually those vessels also, they get together and form one big one. The big one is the umbilical cord. The umbilical cord eventually reaches the baby, okay? And that's where all the transport of things happen. So, the connection between the mother and the baby do not occur, of course, directly. There's no umbilical cord all of a sudden tying with a vessel from the mother and that is exchanged. The blood from the mother never touches the blood from the baby. Okay? You're going to have diffusion of things going up and down, but you're not going to have blood cells, red blood cells crossing each other. Eventually you have some, but it's not because of the, it's needed for gas exchange or other things, okay? And it doesn't happen because you always have this, from a microscopic perspective, you're always going to have these barriers here. So you have the blood from the mother. In order for whatever that is inside the mother to reach the fetus, it will have to cross some of the connective tissue from that placenta. You're going to have the endometrial cells here as well. You're going to have then the epithelial cells of that extraembryonic membrane. You'll have some connective tissue in the placenta. and eventually you reach the blood vessel in the placenta in the fetal side. So the placenta always have two sides. Okay, you have the mother side, which you call the caruncle. You have the fetus side, which you call the cotyledon. The two sides together, you call this unit, you call placentome. Okay, so this placentome is the unit that forms, the placenta. And all of those together, they form the placenta. So Ronaldo, can you differentiate between what is placenta, what is extraembryonic membrane? Yeah, you could say that this is extraembryonic membrane, this, and only these portions are the placenta. But one is basically within the other. So it's, when you call the placenta, you call it all. All this structure you call the placenta. So when I said that depends on the, how these barriers, happen, this is how basically you're going to have a more intimate or a more superficial connection between the mother and the baby. So this would be the most superficial side of it, where just you have epithelial cells with epithelial cells. In this case, yes, you're going to have like some degree of penetration from one cell in the other, but you don't have very much. So this is typical, for example, for cows. Once that thing detaches, you don't need to have, or you may not have much bleeding. Why? Because the two vascular systems are completely separated by epithelial cells, connective tissue, and the blood vessels are somewhat far apart. So anything that has to go from here to here, obviously you have co-transports, active transports, gradient diffusion, but you won't have much, no more than that. You're going to have instances where this endometrial epithelial cells here will be gone. So you're going to have more of the connective tissue straight with the epithelial cells. And in some cases, you're going to have actually the epithelial or the endothelial cells directly tied with those epithelial cells. So it depends on how this connection occurs. You may be able to transport larger molecules, okay, between the mother and the baby. And the other thing, you might have a little bit or a lot or a little less or a little more bleeding during parturition. So we mention all these things. I mention all the time: fetal membranes, amnion, allantoid, chorion. So these are the extraembryonic membranes. The amniotic vesicle, this tends to be the really internal one. Normally we don't consider that part of the placenta, okay? Because it is really it is the one that once you have, eventually you have to do amniocentesis, which is collecting tissue or cells from the amniotic vesicle for genetic purposes, for testing for genetic defects. Sometimes you do that. The thing is, sometimes people don't like to do it because you have to go all the way through. You have to go through the allantoid, through the chorion, through the allantoid, all the way to the amniotic vesicle. Okay? But they don't have, the amniotic sac do not have contact with the endometrium. Okay, so it's not necessarily part of the placenta. Chorioallantoid is the most common in all farm animals. Why they call chorioallantoid is just because the allantoid and the chorion, you can make, if you want to call it just chorion, to me that's fine. If you want to call it just allantoid, to me that's fine. The only thing, again, I want you to understand is that this is the outermost embryonic membrane that actually touches the endometrium. And this chorionic villi, so this chorionic villi is basically at that part where the caruncle is, the chorion will have or start to make a little cellular changes. And this villi will help that penetration, that invasion of cells from the baby towards the endometrium to happen, okay? Very good. So we call it, from a macroscopic perspective, we call it caruncles. We call, like, in this case, cotyledonary, zonary, discoid, diffuse. Diffuse is basically, you can call this diffuse also microcotyledonary. Those are names. I'm not a big fan of asking you guys what are the types of placenta and stuff. But again, they are different in shape. They have some differences in how, the penetration of cells are. Again, why is it important that you know how there's 70 to 100, 90 to 100 placentomes and so on? Yes, we have somewhat of an average among breeds and species of how the shape, the weight, the number of ledons or the placentomes that are. You will see that sometimes we can actually, in some, especially babies that comes from IVF, from in vitro fertilization, they tend to have a slightly different placentation. Their placentation, for example, in cattle, one thing that is very common to happen in cattle, that are babies that are born from in vitro fertilized embryos, is that they grow too much during gestation. And they grow too much because their placenta is a little bit different. Okay? They tend to have smaller numbers. The shape of their placentomes is weird. They tend to be a little thinner, and they have one thing that, eventually at the end of gestation, the mother tends to have some effect on restricting nutrients to the fetus, so the fetus don't grow too much. And basically, in IVF babies, sometimes that doesn't occur, so the baby grows too much, and that comes with a bunch of other problems too. Okay, so structures from a microscopic perspective: blood vessel, connective tissue, epithelium. So we come with all these names. Epitheliochorial. Why epitheliochorial? Is the epithelium of the endometrium with the chorionic membrane or the chorionic epithelium cell. So it's basically that picture that was there. So it's epithelium with epithelium. Ruminants, you can actually consider the same as epitheliochorial. We have a slightly different name for ruminants, and the only reason is that those cells, yes, is epithelium with epithelium, but those cells in the epithelium layers, they mesh a little bit, and by meshing, they create different cells, and they call some of those cells we call like binucleated cells, and they produce stuff. They produce some hormones. They produce, for example, one little molecule that we call pregnancy-associated glycoproteins that today, for example, we use to do pregnancy diagnosis in cows. Okay, so it's produced by this. But for us now, at this point, it just means that you have the most superficial of the interactions. Then you can have endothelial-chorial, dogs and cats, which is the actual. When I say endothelium, it's basically the connective tissue and the endothelium with the chorionic. So there's no more epithelium of the endometrium. So basically one layer less of connectivity, not connectivity, but of intimacy in that case. And then the last one is basically going to be the hemochorial, in which in this case, in domestic animals, we don't have many examples. Humans would be one of those, which is basically the chorion basically gets in contact with a pool of blood already. Okay, no more endothelium, no more connective tissue, just straight a pool of blood. Now, from the perspective of I said from the parturition, yes, these differences may go into saying, oh, one, you have a higher risk of hemorrhage, of losing blood than other species. This is one practical thing that may happen. The other one is the ability to have larger molecules passing through. Okay, So which one of those would be easier to pass molecules? As whatever. The one with more barriers or the one with less barriers? The one with less, okay? So for example, there is one thing that happens or is absolutely needed for these animals that are not needed for this is, for example, when they're born, the ones on top, the ones in epithelial-chorial types of placenta, they have to have what we call passive immune transfer. They have to drink that first milk, the colostrum, from the mother, because that's where lots of the immunoglobulins are. Why? Because they are too big. They don't pass through all these barriers. In the case of humans, this is a lot less important. Okay? So again, another one. This is epithelial chorion, so fetal endothelium, connective tissue, chorionic epithelium, and then the endometrium here intact. This would be the synepithelial chorion, which is the case of cattle. Again, they still have, the only thing is that that layer is weird. But again, for us, the only thing that differentiates or not different, they're similar is that they still have all the layers there. If you had, for example, in the case of endothelial chorion, you would have no more of this, just this in contact with these cells. And hemochorial, you would still remove these endothelial cells and just have the pool of blood, basically irrigating the chorion. Again, these are names. I think one thing that summarizes here is the loss of maternal tissue at birth, basically saying that as you move from epithelial to hemochorial, you start losing more tissue at birth. Some of these names are nice. It's very important just that you understand how many layers there are. Very basic microscopic structures, but the idea is that you understand how they happen. Again, more important than most, and I think the pictures in that case is important, is that from a global perspective, how did it go all the way from that no attachment at all in the beginning of gestation, in the beginning of embryonic development, to then growing, and you have these fluids building up inside that conceptus. As you build up that fluid, you also have contact, physical contact. At some point, in certain points of the endometrium, you're going to have differentiation of cells along with the chorion, along with the embryo. Those points are actually the points that will give birth to the placenta, that will give rise to the placenta. So the placenta is basically, you can ask several people about how you define it is an organ, it is a point of contact, I think it is all of that. Okay, but at the end of the day, as long as you understand that macroscopic concept, to me, that's fine. Very good. So far, so good on the placenta side, understanding some of these, concepts of the placenta. It's not complicated. The only thing is, eventually I'm going to be asked. Now remember, we started all the way from what the GnRH molecule looks like. And now we're going all the way here. It's not complicated. It's just a little bit of information. Okay? All good so far? Yeah? No questions? Curiosities? No? That's fine. So let's give a 5-minute break, and then we'll return.
So you gave me 2.5 and then I wrote a correspondence just to verify a few things. But what I was telling you for me the best way to like learn and remember things. You know, in like the foundation slide, it has like to print that out and draw the curve and when like draw that onto when it obviously is still there and that will remember it so much better than just two lines. Yeah. I think my attack because we got the so they let me. Really? Yeah, it's just so annoying. So they let me steal this laptop and just record.
You see, my opinion about Max. No. It's like my opinion about Max. Everybody has Max.
I know. I guess it's just like I had a Mac before. I was like, I have an iPhone. Oh, I don't.
You are from the Apple thing.
Yeah, so I was like,
yeah, no, but it makes sense if you are into that, whatever you choose.
No, yeah.
I really don't like it, mainly because of the. So I think if it was just for the regular stuff we do,
Not like the music.
I think Macs are they're basically more. They just don't want certain things. It's just annoying.
Like what? Okay, well, you know what I meant? Oh yeah, studying. Because it wouldn't be like
No, it doesn't run that much.
yeah, you can't run like fast.
No,
Yeah.
it's pain.
Oh my god, they're so interesting.
Okay. I made it cool and everything. It's like half the reason why I'm going out.
I was.
God, I wish.
I should have said.
You didn't go more in depth, like you
See, but you know what?
Yeah.
That's what I can say.
more into
Next week,
detail
you
about that.
guys come. You got a point.
Yeah.
And then it's gonna be only you on campus.
Like that anyway. There's
Yeah, if I do guess like that.
It is true. I even forgot. I saw like I dressed my daughter this morning. She looks like a little pumpkin.
Oh, that's fair. It's just like, you want to know, like, I want to know what's missing. Yeah, this is the box. Yeah. Everyone's getting right.
I feel like it's only our class.
Well, it's
Still good.
yeah.
You see, I should have come.
Yeah.
And then people say what? And then people say, what is that?
Oh, wait, I
And I
can see
say,
that. Yeah.
it's a quaternary percent.
So the.
That would do it. You know what? I'm gonna make a placenta.
Yeah.
I'm gonna make a placenta coffee.
Oh, that's horrifying. But here
That
you
would
see
be
the.
people go, oh, this is gross.
And Vigo Pro. No, I didn't.
You're the yeah, this is amazing. I'm gonna make a placenta. Yeah. Then I can put like little things that squirts amniotic fluid.
Like a water gun.
The water guns. You know that go.
I only heard this like
I don't know. It just came to me.
at the Halloween.
Yeah, placenta. A little. I'm gonna make my daughter being the little embryo. Oh, that's awesome. Okay, let's give it an early break because I think it's better before I forget. So now that we've gone through this side, the placenta then after it forms those connections, and it forms like obviously it grows in size as the gestation moves, goes further on, but the structure is basically the same. So you're going to have more and more relative growth. It is greater in the beginning of gestation, but absolute growth is going to be a lot more at the end of gestation. So you're going to have like an embryo going from 1 centimeters to 10 centimeters to 15 to whatever, very quickly in the beginning, but very small. But then you're going to have a biggest increase in size at the end. At the end, at last third of gestation, this is normally where the fetus gains in size. So you're going to have the growth of the placenta as to improve the exchange of nutrients and gases at that point. But aside from that, the next big change during digestion is going to be actually parturition. It's going to be actually the cessation of that process of gestation, and the expulsion of the fetus along with the expulsion of all this placenta, all this extra embryonic membrane. So one thing that is probably people say less, but if you go to our dairy farm, UBC's dairy farm, it's very common to have. We have hostings mostly, all dairy cows, and you're going to have during parturition probably calves that weigh around, let's say, 40 to 45 kilograms. So they're pretty big. Okay, but you're going to have probably almost the same weight of that in fluids and extra embryonic membrane and placenta altogether. So it's a big increase in size. It shouldn't say 45 kilos, but if you put together all the fluids and stuff, it's a very, very big mass of things that have to come out. So very good. So we're going to explain this at the end of this class, the parturition process. Now we're going to talk about a little bit about the fetus itself. So we saw that at the beginning, although we didn't say anything or didn't talk very in depth about the embryology of it, the idea is that eventually by the time it is 45 days, 60 days of gestation, the fetus really, we start to call them fetus, and it really looks like a little, offspring. It really start looking like their own species. There will be a bit, all these changes or these exchanging nutrients will occur through the umbilical cord. You're going to have lots of things coming in and out of that. You're going to have passage of molecules in different ways. But overall, the only thing that is going to be a little bit different too is that the fetus obviously doesn't breathe. The fetus also don't have their digestive system completely used. They have formed, but they don't eat anything. They don't breathe because all of this is done through the umbilical cord, which also basically means that, their system, some of their circulatory system is a little bit different than an adult. Okay? They have to close certain ducts and loops inside the fetus by the time they are at the end, and they come out as a mature fetus. And at the same time, you're going to have, the lungs and the digestive system basically really having their final like development push basically at the time of parturition, okay, or right before parturition. Why? Because that's where they really start to have stuff coming through their whole system, in the case of the digestive system. And in the case of the lungs, one thing that probably some of you have heard about it, which is a problem with neonates, is that they have to produce what we call a surfactant, a molecule that basically creates a little bit of of a tension here between, you know, in the wall of the alveoli of the lungs, and doesn't let the lungs collapse. Once you breathe, it doesn't collapse. And this is something that we take it for granted, because once we do the movements, we have the alveoli of our lungs doing this and this. The only thing is that, as you may understand, some of the membranes, they tend to stick together. And you have to have the surfactant to make that doesn't not stick together. And that really happens at the very, very late stages of gestation, almost before parturition. And if that happens, then you're going to have insufficient lungs and insufficient oxygenation. So these are few little things that happen in the with the fetus. Is not the most important part of what's the placentation side. Is way more important than this next few slides, but just a few things that are worth, you know, passing to you. So before we go into that side, we mentioned that, you know, in the placental circulation, you have all these vessels coming, you know, to at some point converge into the umbilical cord that then circulates with the within the fetus, and then you have another vessel coming out, and you have that being pumped. So you basically have some arteries, uterine veins supplying the placenta, and once it gets to that exchange point, and this exchange is the chorion side on the fetus, the maternal side with the endometrium, the exchange of nutrients will have to occur basically by gradient change or by gradient, you know, difference. Lots of things by active transport is not different than what the transport between certain tissues occur. Okay, so it is not going to be all that of a new thing. This basically, this table here basically tells you more or less how each of these things, calcium, iron, gases, glucose, fructose, amino acids, are transported. The way the fetus, basically, everything inside of the fetus will be the same as what it is inside the mom in terms of plasma content, not necessarily, because you cannot transport everything through it. But the basic stuff, energy, gases, and some of the metabolites will be similar. That's why whatever the mother eats or do will end up somehow affecting the baby. Nature has a way of protecting the babies that is pretty good. You know, some of the idea of not having the maternal circulation touching the fetal circulation is for obvious reasons. You don't want it to have that much of a contact. One, because of, let's say, infectious diseases. You don't want to have the mother infected and automatically the baby infected. You know, and this is true. Lots of gestations, the mother can be sick and have even chronic diseases, and it doesn't necessarily affect the baby, or the baby is not directly affected by it. So this is one. All of the other things, energy-wise, you will see that, you know, ruminants and non-ruminants, they tend to have slightly different fuels, you know, that will eventually go to the baby. Non-ruminants, glucose tends to be the primary source. Fructose and glucose tends to be the primary source of energy for the fetus. In ruminants, because of the way they process, you know, especially, you know, vegetable materials and fur, so before you having all that starch and all that, you know, cell wall material from vegetables, they basically transform, they have that big, you know, rumen, that fermentation chamber before, so they don't, if you look at ruminants, their glucose levels never go so up and down like it does happen in non-ruminants like us. Like we eat pasta and all of a sudden our glucose levels goes to the roof. For ruminants, doesn't happen that way because that pasta first, it is fed to the bugs inside the rumen, and whatever comes out of the bugs is that the ruminant actually ingest. So they tend to have a slightly different molecules that acetate is, for example, one of them. Propionate is another one. Lactic acid is another one. So they have slightly different sources of energy, okay? But again, it will be similar to the mother, okay? This thing, yes, active, passive, transcellular, intracellular, whatever that has to go, it is similar to other cellular transporting processes, okay? So it's not very different. We mentioned this, so now going through to the fetus itself. Obviously, we mentioned a few things on the energy side, but we mentioned this, that what we call fetal period, embryo period. Normally up to 60 days, we call it embryo. Beyond 60 days, we call it fetus. That happens because, yes, all the organs are more or less formed by then. The difference between early and late embryonic periods, it varies among species, but they tend to be related to sometimes the period of maternal recognition, and it varies from species to species. But to me, the most important that you call embryo this, fetal that, after the organogenesis.
Are these days like specific to bovine?
No, it's a range. It's more towards, yes, most of the species with especially more than 6 months of gestation, it happens a little bit like this. But yes, it's not gonna be the same for every species. Okay. So you call it, again, I think this is mostly important for us. Last class when I said sometimes I call it embryo, sometimes I call it fetus, sometimes I call it conceptus. It varies. This is the embryo itself. Conceptus, normally I call it when I include the extraembryonic membranes along with the fetus, or along with the embryo, or along with the fetus. Okay? Again, obviously, early on, endometrial glands, this is how they survive. The embryo survives. After that, by the time the fetus has completed, or the embryo has completed all the formation of the organs and it becomes a fetus, placentation is almost like the initial stages of placentation are done, are completed. So by that time, you already have all the exchanges in nutrients and gases going through the actual placenta and then, feeding into the fetus. So by then, from that little tapeworm stage that we saw in there, by 60 days, you already have an actual or a very well-developed heart. You already have the shape of limbs and head and tail. You already have a little being there. And from that point on, then you're going to have all of those things being done by the placenta. And this is a little bit of what summarized a little bit of what we talked already here. Nothing too different that we said already here. The relative increase, very, very, very extensive or accelerated at the beginning. Absolute growth at the end of gestation. Genetic factors. One of the things, or two of the things that here probably are the most important, is that maternal contribution in terms of the size of the fetus is greater. So if you do cross breeds of the same species that are very different in size, in general, they will be born, the offspring, with a size that is more adapted to the mother. And this has to do because the mother has a way of restricting a little bit the growth of the fetus. And let's be honest, for practical reasons, because of parturition, you cannot have, and that happens obviously. You can go to extremes in canine species, breeds, that you have like very, very big differences. But even in bovine or equine, you have slight, when I say slide, it's visual differences. It doesn't have to be twice the size of the other breed, but in general, the smaller breed will prevail, you know, in terms of the or the mother, the breed of the mother. In some cases, would be the smaller one, will tend to prevail in terms of the size of the fetus. And then after that, as it grows to an adult age, probably will grow more than the smaller breed. But in any case, at the time of parturition, it tends to be born with a smaller size. And the size of the sire influence after birth. Okay, so that's what I meant by that. The other part is that the sire today we have doesn't have to be between breeds, but within the same breed, within the same species, within the same breed, you're going to have quite a bit of genetic differences between individuals. So, for example, in beef and dairy, especially dairy cattle, especially cattle that are relatively big in terms of frame and size, you always tend to go into, or you have ways to select sires, for example, that give birth to smaller calves. And why is that? Because then you decrease the amount of what we call dystocia, or problematic, you know, parturition. And this is, from an applied perspective, a pretty important point. You're going to have, or you probably have heard stories of breeds that, you know, need C-sections all the time, or breeds that have too many difficult calvings or parturitions, and this tends to be a problem. So in terms of birth canal, we're not going to get into, you know, what is the whole thing, or the whole medical part, or the clinical part of parturition, but some species, they tend to have larger birth canals. If you compare, for example, the mare with the cow, the mare tends to have like wider bones, and they tend to have less difficulty with birth. In cattle, especially younger animals, they can have more problems. Animals that have, or what we call polytocals, or have several offsprings, they rarely have problems with parturition because their offsprings are normally very small. So they don't have any difficulty passing through the birth canal. So swine, canine, feline, you don't have much problems. Oh, you know, it's difficult passing, you know, through the cervix and the vaginal canal. That doesn't normally happen. Okay. Well, the other thing that, you know, probably it could be of, you know, important to mention is these different things that, you know, we have in the fetal circulation. We talked about the oxygenation part, which is the placenta instead of the lungs, and actually the nutrition, the placenta instead of the digestive system. That's a given. So they're not actually functional or used at all. They will only be used afterwards. The digestive system a little less, because a little more than the lungs, because the fetus actually ingests a little bit of the amniotic fluid, you know, during gestation, and you do have a little bit of that amniotic fluid going through the digestive system and so on. So it's not going to produce necessarily feces, you know, inside, but it does produce a certain product, a byproduct. In the case of adult circulation, is similar, but it has these three little things here. One, obviously, is the umbilical cord that goes all the way to the vena cava. So it's an umbilical vein. So it's basically that umbilical vein has to go somewhere. So by the time of parturition, by the time the umbilical cord is detached, then you basically close that one. You have this, what we call the foramen ovale, which is basically in your heart. The two atriums are basically together. At that point, it's not that important to have the separation of the blood into chambers in your heart, basically because all the oxygenated blood will come from the mother. So it will basically come from the umbilical cord. So there's not that much need, for the heart to separate. This is supposed to close by the time, of parturition. If it doesn't, you will have problems because you will mix arterial and venous blood in your adult age. And so you're always going to have some sort of degree or problem with the oxygenation of blood that you send to the rest of the body. So in humans, they used to call those blue babies, once you don't have that front, closed. In domestic animals, I don't believe people have gotten to the point of saying, oh, let's have surgery to save, some of those animals. So the idea is that with time, these kind of problems is more and more rare. So you don't have that many because you basically discard most of these animals as they grow. Okay? And this is ductus arteriosus. This is one that binds, or basically you have a shunt that goes from the pulmonary artery to the descending aorta. Again, it is just a few shunts that they have. Eventually, they close and they become exactly like the adult circulation by the time the fetus is actually born. If it doesn't, you may have some problems. This one here, the umbilical vein or vena cava, the majority of problems that happen in domestic animals is not related to the closure of that, but it's related to the infection of it. So if you don't cure the umbilical, the navel, and you have some infection going inside, it can be a primary site of infection if you don't clean that thing up and disinfect that.
Can you explain what a shunt is?
So a shunt would be basically, the next one is, I know it's a bad one, but basically what it basically does is it deviates the circulation from one point to another without passing through whatever it would be. So for example, if you go from the, you have to go from the umbilical cord and eventually, let's say you go straight to the vena cava. So it doesn't go through the liver first, which would be, that's a shunt. That's a deviation of what we did, the normal path of that vessel. Very good. What else? I think the other ones, I think we can go straight now. The very last portion. These two last slides on absorption, secretion of fluids, respiratory, urine cells. This is what basically is in the amniotic vesicle. It is important that you understand, that fluid is there. The major importance for that fluid, especially in the amniotic vesicle, is for physical protection. Okay, so there's a physical thing going on that, the other thing is to make sure that the baby do not stick to walls, around it. But basically the amniotic and this allantoic fluid, they will have a little bit of, some sort of function in there. But at the end of the day, they tend to keep the fetus stable. So yes, there's a physical protection. Yes, there is actual anatomic function because it keeps that whole thing. Imagine those membranes without any fluid inside. You wouldn't be able even to form the placenta very well because you have to have that pressure outwards, in order to have the contact of all of them together. And then we go to the actual parturition. So the parturition will be really that moment that will go from basically 1 or 2 days before the actual parturition to the mechanical side of parturition. So there will have to be a few things changing from an endocrine point of view, then all the way to the physical expulsion of the fetus and the placenta as it goes. From a practical side, it is important that we know when that, or more or less have an idea of the age of the fetus, at some point during gestation. It is a lot easier for you to determine the age, the exact age of gestation of the fetus early in gestation than later. So for example, if you do pregnancy diagnosis in most of the domestic species, by 60 days, more or less, so in cows and mares, or by 30 days or so in sheep, you can determine that gestation by the day. You can go there, palpate the cow, or palpate the mare, or do an ultrasound and say, this fetus have 35 days, 36 days, whatever. Okay, so that's how precise you can be. By the time you move further into 6, 7, 8, 9 months, you're going to have a range. You're going to be, yeah, this is last trimester. This is more like 90 to 120 days. This is more like, so you're going to have less precision. Today, in most of the modern production systems, even for, it doesn't matter which animal you're talking about, because we do a lot of biotechnology in reproduction, we know exactly the date in which we artificially inseminated, or we bred that mare with that stallion, or we have a very good way of measuring. But if you have animals really in extensive production systems, sometimes you do not know exactly the date. So you have to somehow, different systems will have different ways of doing that, because you're gonna know, or you wanna know more or less when that dam or when that mother will have the parturition. So you can do a few things in preparation to it. So a lot of things that we will know in terms of indicators outside the actual knowledge that this animal will have the parturition within a few days is that, one, obviously, you're going to have the enlargement of the mammary gland in the days prior to parturition, okay? So this is going to be the very last class of ours, which is going to be mammary gland development and lactation. But this is the one of the physical, very clear physical signs that the parturition is coming. The second, you have edema of the vulva and actually relaxing of pelvic ligaments. And one thing, once you understand, this basically not only the ligaments in the pelvis, but in the case of the female, most of the ligaments in your body will relax. Okay? Why? Because at that point, and that's because of one hormone that we call relaxin, and the idea here is that the birth canal in every soft tissue that is related to the birth canal is then relaxed. Okay, so because you're gonna have to stretch a little bit in order for the offspring, to pass through the birth canal. And obviously there is the behavioral side of it. Okay, so normally animals that will go into parturition, into labor, they tend to isolate or protect themselves a little more. Okay, so they tend, especially animals that are herd animals, they tend to isolate themselves or detach themselves from the herd and try to isolate them in in preparation to it. We mentioned before that that the maternal recognition of pregnancy is actually initiated by the embryo, by the fetus. They are the ones that produces whatever molecules interfere with tau, estrogen sulfate, HCG, ECG. They are the ones that produce those molecules to indicate to the mother that they are there. They also will be the ones that will indicate to the mother, I want to get out. Okay? So the beginning or the trigger for parturition will come from the fetus. most of the species, the trigger is endocrine, basically meaning at some point the fetus will be mature enough to produce, in this case, cortisol. So their hypothalamic, pituitary, adrenal axis is fully developed so they can produce cortisol, and that cortisol will do the magic, okay? But also there is a mechanical side to it. In some species, that mechanical trigger tends to be very important in the case of mares. So the actual growth, which one leads to the other in many ways, but in case of mares, the actual growth and stimulation of the cervix is what starts to trigger that parturition. But the mechanical side have a lot to do with the restriction in space. At some point, the offspring reaches a certain age or a certain size, that is just, that's it. I cannot fit here. They start to feel basically uncomfortable. They start to move. And eventually that, what they believe is that stress of space is what triggers cortisol to be released because they become stressful. And that's what triggers then the release then of estradiol, oxytocin, prostaglandin. We'll go through that. But then the idea then, after that trigger, endocrine and or mechanical trigger, you will produce eventually at the very end prostaglandin. Okay. And prostaglandin will be the one that then will go on to drop progesterone. Also, the other thing that happens, this prostaglandin has a very, very potent uterine contractor effect. So it starts to stimulate the myometrium to start contraction. So everything that the progesterone was suppressing, now with the prostaglandin, everything goes the other way. So progesterone then is gone, prostaglandin come in, and then you start to have the myometrial contractions. Go ahead, sorry.
Is this when you get like the fetus, like reorientation with the head? How does that work? Is that like when it starts feeling restricting, then it like starts moving?
I do not know exactly why. I don't think the fetus will know. I think it has more to do with almost like, I shouldn't say random, but you know, the actual positioning of the animal leads the animal to be in that position. It's not, because it doesn't necessarily goes like, oh, the fetus is in like a upside down, you know, all the way around, and it turns. I think you just have a way, especially when the embryo is forming, that you you're not almost always, but you're more or less in a position that you can go. The other thing is, like, there's not only one way in which, especially, for example, take, for example, a sow or a dog. They come out backwards, frontward, side. They come, okay? So because they are too small, they don't care. In the other species, it's almost like, I've seen, you know, most of the, you know, I've seen mostly cattle, they come out with the front legs, and then actually the head first, but they can also come out, you know, backwards sometimes as easily. But I do not know exactly how the thing orients. You know, I don't believe this is a fetal action. You know, that they by themselves go and say, the exit is there, and then it goes. But it's a good question. It's a pretty good question.
Is cortisol in the fetus what's unblocking prostaglandin from the
Yeah,
mother?
we're gonna go exactly into that in 2 seconds. But so in all the species, then what you try to do is to, from a practical point of view, you try to leave the animal a little bit isolated. Try to leave the animal alone. So there is a big question, even in the for bovine, you know, when to interfere with parturition. And they have more or less, Janet is doing a bunch of research on that, trying to get all this measurements in video, in sensors and stuff, and trying to see when this parturition starts. Why? Because the idea of when you start applying help, it's important. Okay, you don't want to accelerate the process too much. You also don't want to wait too long before it's too late, because all this process, one of the things that happen is that the parturition is, aside from that first 60 days or a first like third of gestation, where I said fertilization, maternal recognition, placentation, lots of loss in embryo, in fetal, in pregnancy loss. The parturition is going to be the second most moment of loss. Why? Because it depends on a lot of mechanical things to go right. The second part is that, as we mentioned several times, the placenta is what keeping that baby alive. That baby doesn't have access to air at that point. So if for some reason you cut the connection between the placenta or the umbilical cord from the mother, and you do remove that fetus fast enough, it can die as well. Okay? In some species, that can happen a little easier than others, but this is a common thing, to happen. So let's go to the next slide, which will basically, one of the things that happen, then you have this rise in fetal cortisol. As you do that, and that happens because your HPA axis is developed, somehow the space is too bad, gets stressed, releases cortisol. Cortisol goes from the adrenal of the fetus to the placenta, from the placenta to the mother. But in the placenta, this cortisol induces the conversion. In some species, or most of the species, there are going to be a little bit of steroid production, mostly progesterone. But what happens then is that you start to produce estradiol. So your progesterone was always high, during the gestation, and then a portion of that progesterone drops a little bit, because then your placenta shifts from estradiol, or from progesterone to estradiol, go back to the class of steroids, and you're going to see that, for you to change one to the other, you basically need a couple enzymes. And then the rest here, estrogen, oxytocin, prostaglandin, we didn't go into super detail on that, during prostaglandin synthesis, but in your class, even the prostaglandin synthesis during the estrous cycle is it happens exactly like that. You need a little bit of estradiol. Once your progesterone goes down a little, you have a little bit of estradiol going up. As you have your estradiol going up, that stimulates the production of these oxytocin receptors. And once you have these oxytocin receptors, you're always going to have some oxytocin circulating. And then with that, with the binding of that, you start to produce, or you trigger the synthesis of prostaglandin. Once this prostaglandin then kicks in, this prostaglandin goes to the ovary, kills the corpus luteum, then you have zero progesterone source. So your progesterone then goes down, and with that, you're going to have the double effect, which is the progesterone was trying to make your muscles in the uterus quiet, but now it's gone. The second one is that because of that, you have prostaglandin coming. And prostaglandin has this super powerful uterine contractility effect. And then you're going to have that also happen. We have a few more slides. We can continue in the next class. So on Tuesday and Thursday, we'll have basically the last bunch of the group of guys. So we're going to finish parturition, and we're going to complete the postpartum physiology and lactation. And then we're probably going to be done with the actual classes. Then we're gonna have another week of labs, okay? And then after the labs, we'll start the presentation. Is that okay? Good? Oh yeah, the quiz then is gonna be on during the lab, right?
Yeah, you said November 14th.
Yeah, November, yeah, in 2 weeks. Yeah. November 14th, sorry? No quiz.